So my name's Victoria Betton. I'm Director for Digital Data and AI at Health Innovation Kent, Surrey, Sussex. I've been there a year, and I help our local NHS partners, support them in terms of their digital data and AI innovation, transformation type work. Yeah, so I ran a session with Vikki from Aire, and we did a 2-hour session on agile and user-centered design, and we tried to make it a really practical session. So we did some games, we did lots of conversations, small group work, and we got participants to interview each other about a recent GP experience and then take that research insight and turn it into user needs. So we gave them some really practical examples and takeaways for how to take a more user-centered design approach in practice. So there are always loads of barriers to innovation because lots of things fail. Ideas are cheap. Lots of people have ideas. It's actually taking those ideas, understanding the problem you're trying to solve well, and getting that implementation and adoption in practice. And I think sometimes we can have optimism bias. We can think it's going to be easy, but actually there are many challenges and barriers. So I guess what I'm always advocating for is if you take a people and process-centered approach, you pay attention to human factors, understand the problem you're trying to solve, you've got a fighting chance of being successful in terms of innovation. But listen, getting something and designing and developing it is one thing. That's like a tiny bit of the challenge. Actually getting it implemented, adopted, used in practice every day is a whole other bit that needs to be really well considered and thought through. And I think if you follow a defined methodology, if you pay attention and understand the barriers, you're more likely to be successful. But there's so much churn and change in the system, and innovation is relational. It's about trust, it's about empathy, it's about curiosity. It can be hard to have that when so many people are changing roles or losing jobs. So, there's some particular challenges in the system at the moment, I would say.
Yeah.
Oh, so equity. So I'm co-founder of the Equity Charter along with Aisha Rahim and Hassan Chowdhury. And ultimately, it's about health inequalities. It's about a publicly funded health service that's there to meet the needs of everybody. But too easily, we focus on the people that are the most easy for the system to engage with. And we forget about the people that the NHS is less likely to reach because it doesn't pay sufficient attention to doing so. I hate the hard to reach thing. People aren't hard to reach. It's just that the NHS or indeed digital health companies haven't tried to reach them properly. So for me, it comes back to the NHS's core purpose. And I think within the digital health sector, we haven't paid sufficient attention to equity. And so that means that often we design digital tools, products and services that only meet certain people's needs. And then we compound health inequalities, we make things worse rather than make them better. So if we could just be thinking about equity right the way through, which is what our 10 principles are about, then hopefully we end up achieving the aim and the purpose of the NHS, which is to provide healthcare for everyone. Yeah, so this is the first Aire Festival. It's really nice to come to an event that feels very participatory, it's fresh, lots of nice, interesting people. So it's nice to mix things up and have events that are a bit different. And I think they've done a really good job of doing that, and it's been really good fun and really nice to have lots of time networking and meeting with people. And even though I live in London, it is nice to have things up north as well.